I have one correction after Fred's. Metro Health is one word, Mark.
And it's done a lot of work recently to basically map out a series of plan updates to our inventory of documents over the course of this year and probably into next year. So Kevin, do you want to touch on any of that or just kind of give a sense of what some in this group might expect as we sort of move forward with some of those plans on the docket?
Yeah, sure. So over the last year, obviously we didn't have an opportunity to update a lot of or review a lot of our plans. I reviewed the list of all of our plans, and just for everyone's awareness, for the COVID-19 response, we actually utilized 26 of our 80 plans during the response. So those will obviously be the first ones that we look at and try and update based on lessons learned, etc. Also, you'll be getting a series of invitations over the next month to participate in an after-action review process for the COVID-19 response to date, and that will be all-encompassing. We currently have a list of about 50 different agencies or agency types to include in that review process. So it'll be robust and more than likely split up into multiple groups. So this will probably be the longest after-action report we've issued in recent history, at least, if not ever.
Kevin, is I'm assuming Beth Gatlin from the Center for Health Affairs would be part of that health and medical portion?
Yes, and more than likely we would utilize either the ASPR group or the health and medical subcommittee as part of that review process.
And maybe get some representatives from the Zone 1 calls. I don't know if Dr. Wiley would be available or not, but I think Beth and I were in part of most of them, if not all of them.
Good recommendation. I will keep that in mind.
Any more questions on any of that for the after review, after action process? Okay, this should be a pretty short meeting. If you recall, one of the priorities this year, one of the low hanging fruit priorities this year for this group was to sort of set a regular meeting schedule and adhere to it. In the previous 2 years of this group's existence, it was sort of on an as-needed basis that we'd convene these meetings. But the intention now is to really get more of a repetition. And so hopefully you guys, I think most of you responded or acknowledged the meeting dates that were set for this group for the remainder of this year. Today's meeting being one of those meetings in that series. We're just going to try to stick to that schedule and make sure that we are, allowing for us to have a regular touch point with this group, whether or not there's, grant-related voting needed or any of that stuff. So appreciate those of you that did respond to that, and hopefully everybody else saw it was August 16th, October 18th, and December 13th are the remaining meetings for this year that we're planning for. So we're kind of in announcements and other business, and I just have a couple things, and hopefully we kind of go round robin and hear some announcements from everybody. I think a lot has changed again since April as far as the COVID-19 related items. But a couple things from our side, from the emergency management side. Most of you should be aware that the Wolstein Center operation is, today's the last day for that, which is pretty noteworthy. Obviously, as far as, I'll let, obviously Rebecca is on the call for Board of Health, and then Katie to talk about local pod efforts under your updates. But I did want to mention a couple more things. Our EMAP reaccreditation, I know I've mentioned that item to this group several times over the past few months. We finally received our preliminary assessment report out of our EMAP reaccreditation process, which started last October. So we are recommended to be reaccredited by EMAP, and then hopefully we'll be officially anointed as EMAP reaccredited in July. That was a long arduous process for us amid a pandemic. And I know we were able to lean on this group for a few different aspects of that, reviewing plans and processes. And that was very valuable to us and enabled us to get compliance for several different standards. So really appreciate your time and attention to those items. And again, hopefully we will be able to kind of close that chapter on our 5-year reaccreditation in July, and then obviously work toward reaccreditation over the course of the subsequent 5 years moving forward. Want to mention, Kevin already hit on the after action review mitigation planning process. Some of you I've had recent conversations with about our 5-year update to the county's mitigation plan. So we are finally under contract, officially approved contract with our vendor to help us guide that process. Is Michael Baker. We have an initial internal meeting set up to talk about our kickoff meeting when we are going to engage our mitigation core group that will help guide that process. Most of you are, if not all of you, are going to be on that, invited to that process, or contribute in some way to it along the way. But I just want to mention that today because you'll probably be seeing some information from us in the near future about an initial meeting, likely a virtual one, but possibly in-person meeting where we're officially going to kick off that process. I think those are my big ones. Serena, just because we're kind of talking about planning, do you want to give a quick update on the MITEP?
Sure. So the MITEP was sent out initially in May, and then again this last week it was sent out. The MITEP encompasses, as you know, the training and exercises for 3 years. The years that we're concentrating on, of course, are 2021 to 2023. And so I just wanted to make sure that if anyone on this committee or on this call did not receive our MITEP plan, which is the multi-year training and exercise plan. And if you have not received that, please let us know so that we can get you on our distribution. And also let us know if you have any trainings and exercises that are planned this year into 2022 so that we can capture them. Any questions? Oh, that was easy.
For those, I think everybody's probably aware, but MITEP, acronym for multi-year training exercise plan, basically our catch-all to try to document and be strategic about all the different trainings and exercises we're bringing in to our county. But thank you, Serena, for that update. While we're on you, do you have any co-ed? Yeah.
One more thing I wanted to bring up. The state is opening up trainings to counties beginning July 1st. So we'll be putting together some of the state trainings and courses that we'd like to bring to the county in the next year or so. So if anyone has any trainings that they're interested in, whether it be the PDS series, the professional development series, or the APS, advanced professional series, or any state trainings that you would like to have, just please let me know. And John, I know we have a course for you coming up in the fall. So we'll discuss that if you want it in the fall or maybe first quarter next year. We'll see. So I just wanted to.
And I was actually about to type on the side here, but our facility, as long as it's socially distanced, we are opening up the facility again to start planning on hosting.
Yay.
I just want to, get the good news out there that we are once again available. We are open for business. We may need to, depending on the size of the class and the course that we're trying to run, we're still maintaining a 6 foot as a policy internally right now. But for students in the classrooms, but as you know, we can extend that area open to up to 3 large spaces. So I think right now we're able to accommodate up to about 50 folks safely up in that area.
Thank you for that, John, because we will be having our ICS 300 and 400 classes, and your location is just very key. So I appreciate that.
Great. Yeah.
Mark, did you want me to talk a little bit about COAD? I mean, CERT,
Yeah,
or volunteers?
perfect. Yep.
Okay,
The floor is
so
yours.
I'm going to let Rebecca speak more on it, but I just wanted to let everyone know that the larger vaccine clinics have concluded with the Board of Health. Our volunteers were so incredibly grateful to assist during this whole entire pandemic event in both the PPE Distro Center and also at the vaccine clinics. They're even calling me and emailing me now asking if the Board of Health is opening up any other vaccine clinics. But if you, Modic, or anyone else would need any assistance with volunteers doing anything, please let us know. Also, during National Volunteer Week, the executive presented all of our CERT volunteers with a nice certificate of appreciation. So that went out to all of our CERT managers, and they made sure that they distributed it out to their volunteers. And I just want to thank Nicole Curry in our office for being instrumental in doing that for us, getting all those volunteers their certificates of appreciation. And that's it for me, unless anyone has any questions.
All right. Thank you, Serena. Kind of a nice lead into health. Rebecca, do you have an update for us out of County Board of Health efforts?
Hi, Mark. Can you hear me?
Yep.
Okay, great. So, so as Serena mentioned, our clinics have tapered off quite a bit. We're basically doing small community-based clinics out in areas where there are lower vaccination rates. And we're seeing a really small uptake, but we're continuing to do these clinics through the end of the month. I think we might have a couple second dose clinics scheduled for July, but we're meeting on a weekly basis to kind of iron out, next steps and what we're doing. In terms of our case volume, we've really seen a significant drop off in cases. I think all of Cuyahoga County, for all Cuyahoga County, we're seeing between 50 and 75 cases a day, sometimes much less, which is a welcome break and seems like the vaccinations are working. Our positivity rate of those people that are getting tested has also dropped off significantly. So the number of vaccines that we've administered, it's over 58,000. That includes both first and second doses. We did see a little bump in our vaccination numbers after the Vax-A-Million campaign was launched by the state health department. And we're continuing to see decent numbers, but certainly across the state, that bump has come and gone, and we're seeing a drop off again in vaccination. So I think as Mark mentioned, we're working on our agency after action report and are looking forward to participating in the discussions to talk about, things that worked really well and improvements that we can make in our plans and procedures for our next emergency. So that's all I have, Mark. Thank you.
Thanks, Rebecca.
Rebecca, it's Modic. Do you have the current positivity rate for the county at hand? It's okay if you don't. I'm just curious.
I don't. Ours is like it lags by a week or so. So last time I saw the hospital positivity rate was about 5%, but that was from mid-May.
Thank you. It's a good number. Anything less than 10% is ideal, guys and gals. Well, 0 is actually
Absolutely.
ideal.
Yeah, 0 is the target.
Absolutely.
We can kind of stay with the health and medical world. Katie, do you have anything out of CDPH?
Yeah, kind of very similar to CCPH. We've seen kind of a drop off in uptake of vaccines. So we are presently kind of really focusing in on more, again, smaller community-based clinics, working with some of the schools within the city to get the students vaccinated for the school year, and then also for any individuals doing summer school. We have 2 health clinics stood up, one on each day. So we have 2 health clinics stood up each week, offering doses to anyone interested. And then some other kind of significant events we're hosting vaccine clinics at are a barbershop this Saturday, the Juneteenth celebration on the 19th, and then possibly Ward 5 Festival on the 26th. And just another big activity we're working on is homebound individuals. So we have our ice cream truck model going out twice a week, vaccinating individuals who are homebound, doing both Pfizer and J&J. And then kind of total vaccination numbers approximately. So from the start of all this to probably this past Friday, we're at around 59,000 vaccines administered. That's first and second doses. And as of right now, again, continuing on through the rest of June, these smaller clinics and homebounds. July, again, we're just going to have our health clinics stood up and then finishing off some second doses, but nothing specifically planned right now. And we have an outreach team working with community organizations and other kind of community events where we're trying to host vaccine clinics. So those are really all the updates I have right now.
Okay, thank you, Katie. Mark, hospital perspective, how are you guys doing?
So like public health, we are winding down our pop-up drive-through clinics. We're still trying to do focused outreach to more of the underserved folks. We're going to, transition into, kind of routine giving vaccine and those sorts of things. So if anyone wants it, we have it. And that's true throughout all the healthcare organizations in the region. Zone 1 calls for speaking to that healthcare organization coordination. They're decreased once a month at this point in time, just because there's not a need to meet more frequently for coordination. Everyone's moving towards working on their after action reports, different approaches, kind of smaller sessions, because again, I don't think anyone anticipated, not in my world, a whole year plus of trying to debrief things. At least Metro and I think the other major healthcare organizations, we're moving to identifying people if they've gotten vaccine. If they have, then we're data driven here, so there's no mask requirements in meetings and those sorts of things. Always in clinical areas still, but in the public areas, we're kind of mirroring what the data shows us. And otherwise, that's pretty much it. Probably the thing that's leaning forward, and I know it's going to be an acute issue in healthcare in the coming years, maybe other sectors as well, but I don't want to necessarily call it the level of burnout, but it's the level of I'm not going to do this anymore. So I don't know if that's a burnout or just whatever that may be, but just more of the mental health and behavioral health impacts that some of our frontline folks have had. And then I also see the folks that have been really isolated. So you're in the front lines of the battle. I think there's an impact. And I think also if you were, sequestered to prevent the spread, I think there's also that challenge. So, be well, get outside and help each other.
Yeah, we joke around that here, just like the fatigue of like having to even fathom, another spike or this, over the wintertime if things accelerate again. It's hard to think about mustering that energy to continue to deal with things like this. And obviously we're even further removed from it than the frontline healthcare workers and stuff. So I understand that's probably a pretty significant concern for a lot of those folks. But yeah, appreciate your update, Mark. Yeah, I'll just go to John real quick. Utilities sewer district. John, how are you doing?
Yeah, so obviously we're recovering at this point. This is kind of the official recovery date as established from our reconstitution team. So we're now starting to open it up to the public again in the process and hosting meetings, et cetera. In terms of the general data and the data that we're looking at right now in the streams, it continues to either hold steady or trend downward steadily. So thankfully we've got that ability to kind of look at least a little bit ahead before we start to see any sort of warnings or indications. And as an agency, obviously, we're tied pretty tightly to Board of Health and some of our folks out there so that they have a little bit of a heads up and they can give you a heads up from that end. But yeah, generally everything is moving to the after action phase and really just trying to develop an improvement plan associated with what has happened during the context of this incident. And then be prepared should we see resurgence, right? So just surveil and keep a tight eye on that in the
So John, it's Madik. You've faced, your audio went out a little bit, but I'm curious. So for the future, the regional sewer district, will they be continued monitoring for COVID? Is that kind of an ongoing plan? And is that sort of a daily sampling, a weekly sampling? I'm just curious of the frequency of that.
That's a great question, and I'll try and speak a little louder for this speaker. But yeah, so we take samples twice a week. Right now, we'll continue to sample twice a week. We're going to have broader conversations with a number of other agencies about whether or not we continue to surveil at that level or beyond June. There's still some conversations about whether or not that will continue in terms of the investment in the dollar and the associated staffing hours with that. But right now, and just to report back to this group, right now the intention is to continue to move forward and surveil at least twice a week. And that's kind of where we're at. That's the quick capture as of today.
Thank you.
Thanks, John. Moving along, I see Cleveland. Fred, how are you guys faring?
I'm doing well, Mark. Thanks. Just a couple of items for us. One is that the EOC here in Cleveland is partnering with health and others on the vaccine distribution effort. We have calls each week that kind of goes through the issues that we're dealing with. And Katie kind of articulated where the city is in that effort. The EOC is producing weekly sit reps every Monday. We're putting out our situation reports, and I hope they have some value for you. Now that the public events have started again, the EOC has 4 planned activations for the remainder of the year. The closest one out is the July 4th fireworks celebration, so we'll be activated in a monitoring capacity for that one, and there's 3 others by the end of the year. As far as unplanned events, we've been monitoring the social demonstrations. There were a number of Free Palestine demonstrations in downtown Cleveland. They were all peaceful, very large, and we were monitoring those events as well. The other issue is that many of you may know that next year Cleveland's going to host the National Homeland Security Conference in 2022, and that's a large event. We're very pleased to be awarded that conference, and we'll be working very diligently in the next several months on the planning process for that. The current year, the 2021 conference, is taking place in Las Vegas in August. Somebody really figured out a great time to go. They should have held it on the face of the sun. I think it would have been a little bit cooler, but in any event, there is an event this year, and we'll have a contingent at this year's conference to talk about Cleveland's participation next year. So that's pretty much from us what's going on right now.
Okay, thanks, Fred. Laura Gold, do you have any update or perspective on just where things sort of stand right now with any of the populations you work with or serve? I know, and I just want to caveat this too, that we're probably going to be leaning on you pretty soon here with some of these plan updates as we embark, on some of these plans that are going to have relevance to ensure that we're addressing adequately access functional needs pieces in them. But just kind of curious, do you have any current perspective that you'd like to share with us?
Hi, Mark. Thank you. For those of you who do not know me, I work for Services for the Department, which is a nonprofit agency that provides services and advocacy to people with disabilities in Northeast Ohio. I just want to bring to your attention that there is going to be a new disability information and access line. It's called DIAL, and it's going to be a line to help people with disabilities find vaccine location in their community and help them with making appointments. And I really work with that information as soon as it becomes available.
Great.
As we are finishing up a home modification and emergency preparedness program, where we received a grant to provide home modification to people with disability who needed to, in order to remain in their home, to be safe, and at the same time, we are available to provide education to people with disability on how to prepare for emergencies. So we finish that grant up.
Okay, great. I appreciate you being on the call this morning and again, being part of our group. And like I said, you might come to regret that when Kevin starts bombarding you with requests for perspective and review and plan reviews coming up here soon, now that we're going to be playing catch up over the next, decade of our lives. But thank you again. Moving along, Tom, Red Cross, I know you guys had sent out some information about shifting back to doing congregate sheltering models. Do you want to update the group on any of that and anything else you might have out of the Red Cross side of the house?
Yeah, we're just starting the process of resuming in-person batch calls. Additionally, we'll be doing congregate sheltering nationally as the primary means of sheltering in response to disaster. So a lot has to do with availability of hotel rooms. A lot of them are 70% booked right now as well.
Okay, and you were kind of fading off on my end a little bit there, but did everybody hear that the Red Cross is shifting back to congregate sheltering? Okay, it might just be my speakers, my integrated laptop speakers.
No, Mark, that was helpful to amplify. Thank you.
Sure. Anything else, Tom?
That's it.
All right, thanks. Let's see. I know I see Lieutenant Petrie. Anything out of the law enforcement or higher education perspective? Any updates?
I really don't have anything to update other than, what's already been said about, some of the planned protesting that has been going on, but has been remaining peaceful in the area. I'm actually looking forward to, getting back to trying to put on some exercises now that, we're coming through this pandemic. So hopefully I'll be able to add some of those things to your exercise map or whatever.
Yeah.
So nothing really, unless anybody has some questions. I mean, we're finalizing the Wolstein Center today. That was a pretty good undertaking for our law enforcement agency, as we provided a lot of the security for that. So we're looking forward to kind of coming to a close with that. I think they're having an after action exercise or meeting today around 1 o'clock. I don't know if you're part of that or not, but that'll be taking place at the Wolstein Center. That's all I have, unless anybody has any questions.
Okay, thank you, Lieutenant. Chief Gallegos, anything out of fire?
Hold on 1 second while I get my video set up there. I do not have any report, but what I do have is a question for the group. Has anyone heard anything about what we're supposed to do to get our second vaccination? Because if I'm not mistaken, the vaccines were just good for 7 months. A lot of us were done, February? So we're going to be coming up on those dates here soon. I was wondering if anyone heard if it was extended or if it wasn't extended. What are we thinking about for the second round, if you will?
So Chief Galgus, so the current research right now, you're talking about booster shots for either Pfizer, Moderna, or J&J?
Correct.
So,
yeah, for the first
yeah.
responders.
Yeah, so right now, it seems like there is pretty good immunity, and they're still trying to figure out what that is. So there's two levels of that immunity. That first one is having your antibodies. So when we got that second dose or first dose, depending on which one, you really revved up a lot. It even revved up a lot more if you had naturally gotten COVID, and then you got the vaccine. So you probably have the highest level of immunity, not only to the original, but to the variants. Another thing happens for the body is that it doesn't necessarily forget it. And it's called it's kind of a memory DNA that goes into our bone marrow, so that if we get reinfected again, the body says, hey, I know who the heck you are again, and I'm going to ramp up and kill you. So right now, that's where the studies are at. It seems like there's still very good, strong immunity up to a year afterwards. And because this is our first experience, it's just a matter of kind of drawing those titers and doing exposures to folks. I know the major vaccine manufacturers that are accepted here are doing booster shots, doing research on booster shots when we need those. And again, it might be annual, it might be every couple of years. I do think it seems pretty good on that new technology, the Pfizer and Moderna, that there seems to be a little longer there. So more to come. And again, all the basics that help us all the time are, washing hands and all that, regardless of vaccine, as you guys well know. So the other thing that'll probably occur is, a little bit more, other infections as people get re-socialized and all that, common colds and all that. So I would expect that to occur, but nothing obviously that would lead to hospitalization. So the bottom line is vaccine is really effective. If you haven't gotten it or folks haven't gotten it, go get it. It really does go a long way to get us back to normal and does really provide really great protection for us. Hope that helps.
It does. Thank you.
Mark. Anything else, Chief?
Not for me.
Okay. Have I gotten through it? Paul Owens, do you have an update? You're still on the call?
Yeah, nothing really from Case. We're just wrapping up our vaccine and all that probably by the end of the month, so nothing else.
Okay. All right. Oh, I see Michelle Sowers, Ohio Emergency Management Agency. I saw you called in or hopped on a little bit late. Do you have any update from the state?
Hey, Mark, can you hear me?
Yep.
Hi. Yeah, so I don't really have anything new to add. Our big thing is the Wolstein Center that we've been working at for the past several weeks. Without closing today, we're going to have everyone back in Columbus after that. We have been focusing more on our typical activities. I know we had some lakeshore flooding last week out in Lake County, and we had some out further west. So we were doing public assistance support, damage assessments, things like that. So, we're just kind of like everyone else transitioning back into what life was like and our jobs were like before COVID happened, while still maintaining, our posture with COVID, just kind of waiting to see what happens. So we're still around and we're here if anyone needs anything.
Thanks, Michelle. Any other final updates, questions, anything that somebody wants to talk about right now?
Mark, I guess I just didn't say, just so everyone knows that the virus is still circulating out there. So if you've got not a lot of comorbids and a pretty good immune system, you've got good protection. So again, we're not through it. We're substantially through it, I think. And unlike the other waves, we've got a good tool in our toolbox, which is vaccine. So even if there's a little bit of a spike, and you'll read that for the teenage population now until they get to quote a higher vaccination rate. And then they're also researching, obviously, to do vaccine for those that are 2 and older. So that should come out probably towards the end of the year. So thank you.
Thank you for that, Mark. It's some peace of mind, so I appreciate you sharing that perspective. So I really have no other updates beyond what I've discussed. If there's nothing else anybody else has, then we'll move on to next meeting determination, which I mentioned earlier, I think is August 16th. I'm not sure where everybody's at with this, but obviously meetings are beginning to be held again in person. So that's something that we could consider. Maybe not the August one, or maybe the August one, or at least one of our next meetings this year. Actually, reconvening this group in person. I can float that idea over an email and kind of get a sense of where everybody's at with that. And then obviously we can kind of do a hybrid in person / call-in meeting if we wanted to do that too. So, but again, next meeting as things currently stand is scheduled for August 16th. With that, I will entertain a motion to adjourn the meeting.
I so move.
This is John Corn. I say.
Okay, John, thank you. Any opposed? All right. Again, appreciate everybody's time this morning. Great seeing all of you, and we'll plan to talk again in August. Have a good summer vacation if you're taking one between now and then. Take care.
Thank you, Mark. Good seeing you, everybody. Be well.
Take care, everyone.
Adam, are you still on? This is Denise.
Hey, Denise.